Thank you, everyone, for joining. We're going to start in just a moment. Well, hello and welcome to our celebration of the 2023 City Health Medals. We are so glad you all are here today. I'm Catherine Patterson. I am one half of the co-leadership team, and we will be joined by Katrina Forrest, the other co-executive director of City Health, in just a moment. Today, we're excited to share the results of our annual assessment and to celebrate the amazing achievements that cities have earned in their journey to improved health. I do just want to note, if you have a question, we would love to hear it. Please let us know by clicking on the Q&A button and submitting it, and we will get to those later in our program. We will get to the results of our assessment this year in just a moment, but first I'd like to welcome those that are new to City Health and tell you a little bit about who we are and how we work. City Health is an initiative of the de Beaumont Foundation and Kaiser Permanente. Our mission is to promote upstream health-related policies in America's largest cities. In 2018, Kaiser Permanente joined the de Beaumont Foundation as City Health's second national partner. Our goal at City Health is to provide tried and true policy solutions that increase access to healthy choices and create opportunities for everyone to live full, healthy lives. You'll see here on our screen right now a footprint. These are all of the cities that we have a presence in and also assess every year. As you can see, these 75 cities represent geographic diversity, but they are also politically diverse and are in states that vary widely in respect to local authority and preemption. This next slide just highlights the 12 policies that we advocate on behalf of. Our 12 health promoting policy solutions provide city leaders with a menu of policy opportunities that are centered on health equity and address critical health disparities, because who you are or where you live shouldn't determine your opportunity to live a healthy, full life. These policies focus exclusively on upstream, prevention-oriented interventions that are designed to address the social determinants of health by preventing health issues before they start. Here is an example of how individual cities earn overall medals. There's a high degree of flexibility built into our policy package. No city has to earn 12 individual gold medals in order to earn an overall gold. To earn an overall medal, cities must earn at least 5 individual policy medals at that medal level across all of the policies. This flexibility enables city leaders to choose the policies that work best for their individual communities based on the unique needs of their cities. I would be remiss if I didn't take a moment to give a shout out to all of our incredible partners. For every policy solution in our package, City Health partners with a leading organization who provides technical assistance, subject matter expertise, and assessment support. I know some of our partners are on the call today, and I just want to take this moment to say thank you. Thank you for your partnership, and thank you for all that you do on behalf of the cities and on behalf of city residents. And for city policymakers on the call, we want to connect with you. If you see an organization on the screen that you would like to be hooked up with, we are happy to do so and would love to engage with you. And now I'd like to pass it over to my colleague, Katrina Forrest, who will discuss our 2023 medals. Katrina?
Thank you, Catherine, and good afternoon, everyone. As was mentioned, my name is Katrina Forrest, and I am the other half of the co-leadership team of City Health. And I am incredibly excited to share the results of our 2023 assessment and to celebrate city achievements in health. This year, 61% of cities, that's 46 out of our 75, earned an overall medal. This represents a 12% increase from last year, when less than half of our cities earned an overall medal. This means that more than 43 million people now live in a city with an overall City Health medal, an increase of 4 million people from last year. This progress is truly amazing, and it's what our work is really all about, using health-promoting policies to improve the lives of the people that call our cities home and putting them on the path toward better health. Now here you can see our 2023 overall medalists. Congratulations to the 46 cities who have earned an overall medal. These cities have earned their overall medal by earning at least 5 individual policy medals at the same level. I do also want to give a very special shout out to our gold medal cities, Denver, Boston, Minneapolis, New Orleans, who we'll hear more from in just a bit, Portland, San Antonio, and St. Louis. All 7 of these cities have reached our highest honor by earning at least 5 individual policy gold medals to earn their overall gold. These cities really do stand out as exemplars, and they are true leaders when it comes to health and creating the conditions that enable our residents to be healthy and to thrive. Again, congratulations to all of our cities. Your commitment to passing evidence-based, health-focused policies means that you are leaving a legacy of health in your communities. This next slide provides a full medal breakdown by policy for all 75 cities. And there are a couple of things here that I want to note. We have several policies that saw significant medal penetration, to include high-quality accessible pre-K, which continues to be a top priority for city leaders with 67 total medals. Green space is the next most adopted policy with 52 medals. Now, green space is a policy that has benefited from federal investments through the Inflation Reduction Act and bipartisan infrastructure law, with cities leveraging those resources to build parks and increase tree canopy to mitigate extreme heat and weather. Affordable Housing Trust was another policy that had our most growth. We had 44 medals here, but it was an increase of 8% from last year. As housing is one of the more intractable issues facing city leaders across the country, many leaders have turned to trust to create flexibly designed funds with dedicated local funding to address myriad housing needs. We also have 3 policies for which there's been great energy and momentum, though the medal uptake has been a bit slower. These policies really do present a significant area of opportunity for us in 2024. And the policies include legal support for renters, which has a total of 16 medals from us this year. This is a policy that is about the codification of a right to counsel. It is a proven intervention that we know can keep those tenants who are facing eviction housed. It can decrease the use of homeless shelters, and it can help tenants who want to move to do so in a way that preserves their long-term housing stability. And while there is a lot of energy and momentum around this particular policy, the threat of state preemption in this area is having a chilling effect. And there are some cities that are now exploring pilots or other programs rather than adopting binding policy. Another area of opportunity for us is in flavored tobacco restrictions. Currently, we have 21 cities that earn an overall medal in flavors. We may see more local action in this next year. As many of you, I'm sure, have seen, the FDA has delayed its rulemaking that would ban menthol cigarettes as well as flavored cigars. So instead of waiting for federal action, many cities have the opportunity to act now to pass comprehensive flavored tobacco restrictions. A third policy where we are seeing a lot of energy is healthy rental housing. Now, currently we have 24 cities earning medals in this policy. This is another housing policy that is about proactive rental inspections. And again, there's a lot of energy and momentum here, but preemption remains a challenge. We know that cities in Tennessee, North Carolina, and Arizona are prevented from implementing healthy rental housing programs. So in summary, we have a lot of opportunities, but we are also wrestling with some challenges. On the opportunity side, housing, education, and green space are all areas and policies that saw a lot of growth. And these are domains that we know are aligned with local priorities. They help to solve pressing challenges, and I think we will continue to see interest and growth in these areas over the next few years. On the challenges, as I've said, we are continuing to see state-level preemption have a chilling effect on policymaking. We've seen states like Texas and Florida pass sweeping preemption bills restricting local authority. And in response to this, we have seen cities attempting to think creatively and identify ways to circumvent preemptive action by implementing policies through non-legislative measures, things like ballot initiatives, pilot programs, and other opportunities. This is an area that we will continue to monitor, and we will work closely with our cities. So that is our high-level summary of this year's medal findings. The complete results, including our report and methodology, are available at cityhealth.org. You can also explore how each of our 75 cities rates across all 12 policies. You can see our reports, our policy briefs, and other resources, once again, if you visit us at cityhealth.org. So I will pause here before continuing with the program to see if there are any questions. Well, moving the program along. Today, we are going to take an in-depth look into one of our 2023 gold medal cities, the city of New Orleans. This is the first overall gold medal earned by the city after having earned an overall silver medal in last year's assessment, which was our first time assessing the city. Now, New Orleans earned individual gold medals in complete streets, green space, legal support for renters, safer alcohol sales, and smoke-free indoor air. The city also earned silver medals in affordable housing trusts and high-quality accessible pre-K. And finally, New Orleans earned bronze medals in healthy food purchasing and healthy rental housing. Now, this fall, CityHealth had the amazing opportunity to travel to New Orleans to profile one of the city's gold medal policies, legal support for renters. And we have an incredible short video that will highlight the city's gold medal efforts to protect residents from evictions that we'd like to share with you before we dive into our panel discussion.
I've had clients say nobody has ever stood up for me like that in my entire life, and that means something to them, and it gives them hope, and it makes them feel worthy in a way that they should, but that they haven't.
CityHealth understands that everything touches public health, and housing is absolutely a part of that.
Well, New Orleans is one of the greatest cities in the United States, probably one of the greatest cities in the world.
I think most people know us for our food and our music and our world-class culture.
This wonderful city of New Orleans is who she is because of her people.
The city has so much life. There's so much to do. New Orleans is a very gig-based economy. We are very tourist-based.
It's this land of like true diversity, both culturally and also in thought.
It comes through people. Of course, it's felt throughout the streets of the city of New Orleans, but what makes it so special is ensuring that we're investing in our people. And so what we're talking about now, I think, is a real reflection and an example of that.
When COVID started, we had 5 attorneys, 1 secretary, and 1 paralegal. And we were running around like chickens with our heads cut off.
In the New Orleans area, we had about a 300% increase in the amount of people seeking our services post-COVID. So we decided in early 2021 to approach Chief Judge Henry, who was the Chief Judge of First City Court at that time, about starting an eviction desk because we knew that we weren't reaching as many people as needed help. By the end of the year, when there was an attorney present, the tenant had about a 450% better chance of getting a favorable outcome than when they were on their own.
Right to counsel really came to be by embracing the existing and known conditions in this city, recognizing that New Orleans, just its fabric, we're a city of majority renters. And the rental community are the backbone of the culture of this city and really the backbone of the state of Louisiana.
The biggest problem is that you had these landlords who really understood how everything worked and how the court system worked and the eviction process worked. But you had these renters that had no idea what was happening or what rights they had or how to work through the court system to come up with some type of alternative to be able to stay in your home.
We've been knowing we need right to counsel forever. I came here almost 30 years ago on an eviction prevention grant. And at that time, that was the only funding that we had from the city of New Orleans specifically to do eviction defense work.
We're outside of First City Court. This is where the evictions are held in Orleans Parish on the East Bank. So I have eviction court today. I have a client that is facing eviction for non-payment of rent. We're hoping to work something out with his landlord, and we're going to get in there and we're going to see what happens. So in Louisiana, if you lose in court, it could be a 24-hour minimum. Generally, if you show up to court and if you have representation, you will get more time than that, and you can get it by consent or some sort of settlement agreement so that you don't have an eviction on your record. And the right to counsel allowed us to partner with the Louisiana Fair Housing Action Center and Jane Place. And Jane Place helps to notify people if you want an attorney, you have the right to one, you can get one. Here's how you can access them. And then they also keep data for us.
Okay. So what's going on exactly? Here at Jane Place, we have the Eviction Court Monitoring Project. We observe massive racial disparities, gender disparities. The majority of people who were facing eviction were women. The majority of people were Black. 56% of all tenants altogether were Black women. Majority of those Black women talked about caring for other individuals. And so we realized, if this is a majority Black city, we're evicting the city.
Stable, safe, affordable housing is a significant determinant of health. When you have a place to live that is itself healthy, and when you have the security of knowing that you will not be evicted, then you are able to do the things that keep you healthy and to tend to your basic needs.
So right to counsel has really leveled the playing field for a lot of tenants in our city, because now tenants have someone they can call.
This is a good thing for everybody. We are all on the same team. What we want is healthy, habitable housing for our community. We want our community to be better. And this is a way to do that.
We saw a decrease in evictions. We saw an increase in trust, and you can say, oh, started from the bottom, now we're here. Oh my goodness, this is great. So I'm appreciative and I look forward to more work that we're going to do.
No one in our community should be held back by not having enough basic needs. I want to be a part of supporting those where we can and making it a more equitable place.
I firmly believe that in our world, that every county can figure out a way to bring right to counsel into creation.
While our fabrics of neighborhoods and cities may be different, there are some common threads and common denominators that are rooted and grounded in people and through dignifying people.
That video is such an extraordinary example of the power of policy, and it really puts a human face on such a critical issue. The video, which premieres today, is available on our YouTube channel and our website, again at cityhealth.org. Now, unfortunately, Mayor Cantrell is unable to join us today, but we are so grateful for her leadership, for her commitment, and her dedication to health. It has truly been such a joy to partner with her and her administration, and we'll hear more from Dr. Avegno in just a bit. And we look forward to continuing to support the city of New Orleans and all of our cities as they push the envelope forward and strive to improve the health for all of their residents. With that, I will now turn it over to City Health's Director of Government Affairs, Akeem Anderson.
Thank you, Katrina. Hello, everyone. I am delighted to be joined today by the New Orleans Health Director, Dr. Jennifer Avegno. Dr. Avegno was appointed by Mayor LaToya Cantrell in 2018. Before joining the health department, she was an emergency room doctor at University Medical Center and served as Associate Clinical Professor of Emergency Medicine at Louisiana State University Health Science Center. She is a New Orleans native, and from what I have been told, she is the owner of the best gumbo recipe that any public health director in the country could have. I'm looking forward to this discussion. Dr. Avegno, thank you for joining us.
Thanks, and that might be what I'm most proud of.
The gumbo?
Yes.
Yes. First off, congratulations on your gold medal, your overall gold medal. New Orleans has been on a journey to better health. This year, I know, marks the 125th birthday of the health department. Can you just tell us, what does it mean to be recognized as a city largely led by the work of your office with this achievement?
Well, I think, it's really gratifying to certainly all of us in the health department, and then in larger city government. We all live here. This is our community. And we get up every day because we want not only gold medal health for ourselves, but for everyone, our friends, our neighbors. And so, our team has been through an awful lot, like many health departments in the last few years and even before that. And so to have the collective work, and not just the work of the health department, but the work of our other city agencies, because so much of this is interdepartmental, interagency, and with external partners as well. So just to see all that hard work paying off is really meaningful.
I have lived in the city, lived in New Orleans previously, and have gotten the chance to work with you and your staff, and Mayor Cantrell and her staff, and a number of city council members. In talking with the elected officials, there is a clear understanding of the importance of the policies that are in this in our policy package and its connection to public health. How are you able to build that level of understanding and cooperation around a public health agenda?
Yeah, and I think that is really the crux of it. When you have a mayor, an administration, and a legislative body who all recognize the foundational importance of public health and really that health in all approach, understanding the health impacts of housing policies, of safe streets, et cetera, then the work becomes easier. And I think we saw that really clearly in COVID, where you had health leaders that were at odds with the executive and the legislative branch, that those communities were not as successful at caring for their people and at moving forward quickly. So for us, it was communicating why health should be at the table in so many other initiatives, and also helping decision makers to reframe the way they think about issues. And that we've talked about, let's say violence, for example, we've talked about it in certain terms for a very long time, but when we reframe it as a public health issue, here's what you gain, and here are the ways we're able to be more creative in looking for solutions. And so we've worked really hard to communicate the importance of health in a wide variety of sectors within government. And I think, I'm grateful that our decision makers have been very open to that, but I think there's a lot of decision makers nationwide who, if they saw it that way, might change the way they think about allocation of resources or policies.
Following along those lines, because I've had this discussion with a number of public health officials across the country, and they seem to be struggling with helping policymakers make that connection. What advice would you give for other local public health leaders trying to build that level of understanding?
Well, I think one of the advantages that public health has is robust data, and it might not always be in the place we want it or exactly how we want it, but we are trained and comfortable with looking to the data to tell a story, both quantitative and qualitative. And I don't think that is as true as of a lot of other city departments. So when we're trying to make a case, we really drill down on what data do we have, how do we show this, and then also how do we blend it with that personal narrative? Because I think that decision makers want to see the numbers. They also want to see the return on investment, and that's something that public health, I think, has got to pivot towards, and many are starting to do with, is saying every dollar invested in this particular policy or program is going to pay you dividends in this other sector in a way you probably haven't thought of. And so showing that return on investment, but then also marrying it to, and just as your video did, the stories, the people whose lives are affected, the constituents. If we can do those together, I think that you're going to get a lot of traction at higher levels.
I appreciate that, and the support that your office gave in connecting us with some of the people on the ground working on legal support for renters. Before we released the video today to the general public, I had shared it with some other cities just who were thinking about that policy, so they can try to connect the dots in terms of the stories and the people connected to these policies. I want to go back to the pandemic and the work your office did around during that time period. A city like New Orleans has such a vibrant social culture. How are you guys able to communicate with the public about the rationale and importance of many of the public health measures taken during the pandemic? And how did that help build the trust that you guys have with citizens in New Orleans?
Yeah, I think that that was really an advantage that we have. We are a very tight-knit community. New Orleans is one of those places. It's a big, small city. Everybody knows everybody, or you're no more than a degree of separation away. And one of the great tragedies was that we were hit very early on, with New York in that very, very first wave, and hit very hard. So as a community, there were very few people in our community who weren't immediately affected. And so they didn't have to take a lot to show people the importance of adhering to certain public health measures. And then understanding our culture and understanding what makes New Orleans special, and utilizing that to really drive our response. We were one of the first cities in the country, if not the first, to put testing sites in neighborhoods. And that came from our team having a deep understanding of our community and a deep understanding of the access challenges that have historically plagued many of our communities, and saying, okay, well, we know how to solve that. Let's do it in the community. And then similarly, working with our cultural community to tell the story. Our campaign for testing and vaccination was largely built around our culture bearers, because we knew every individual, every resident of the city could identify with them. And for us, it was also about what are our shared goals of a community. Our shared goals are to stay healthy and to avoid the extreme loss of life we saw initially, but also to get back to our life. And for us, life is carnival, it's celebrations, big gatherings, right? And so telling the story of, if we want to get back to doing the things that make us special and that we love, there are some things we have to do first, really resonated. And not every city is New Orleans, right? But every city should understand what makes it tick and what brings people together in that city. And I think if you have good communications, and I think our team really did a good job, you use that to make it relevant for your city.
I remember, so I am a Falcons fan. I grew up in Georgia.
Oh,
That did not make me many friends during my time in New Orleans, but I try to make it back every year when the Falcons are playing uh, the Saints. And I remember during the pandemic when things were lifted and we were allowed to travel, my friend Eric, who attends the Falcon Saints games with me every year, he had left his vaccine card back in DC. But it was also time for him to get a booster. And we were able to go to the public health, your website, with ease to find a place where we could easily get a booster. And I think you guys were even giving out digital vaccine cards to be shown at every restaurant or bar that you entered in. And so just the thinking about the users on the back end and the ease of for people to be able to do that, goes to show the point of the deep connection that you have with the city and the citizens, and thinking about them on that aspect.
we even gave them out outside the football games, right? So that because we had a mandate. And so, you know, if we, again, it's about this balance between promoting health and knowing the things we need to do to protect population health, but also not making it onerous or punitive, saying, yes, we really need you to have a vaccine in order to enter this risky environment. But look, we're going to have one right here, so that if you didn't think about it, you didn't do it, here you go. We're going to do it. We're going to make it as easy as possible because we want you here. We just want you to be here safely.
So going back to the conversation about connecting with elected officials, I know many public health directors work closely with mayors and city council members to adopt and implement health policies. Often, public health departments are the key messengers to inform the public about the programs and benefits they have. But in a world where pandemic fatigue is a real challenge for public health communications, how do you ensure that the public knows about and can access the services your department provides?
I think one of the things that the pandemic did for us, and maybe for others as well, is it gave people an understanding of what the local health department could do. As most people know, you've seen one public health department, you've seen one public health department. They are organized so differently in different cities, counties, states, and it can be really confusing to know. Do you inspect restaurants? Do you check my water? What do you do? So because of the pandemic, we had to really build out a communications infrastructure that we had not had previously. And now we're able to use that same infrastructure to message about all the other things, all the wonderful things that our team was doing pre-pandemic that maybe were really under the radar because we just didn't have a mechanism to get the word out. What I hope is that we've built trust with the community. So when they see, oh, the health department is doing this or that, they'll feel that this is a governmental agency that's really working for them. And it's helped us with decision makers. When we were asked early in 2023 to put together a violence prevention strategy for the city, it's because they had recognized the work that we had done in other places, in other sectors, and were giving us the trust to do it in another. And again, for us, it's not about touting our accomplishments or, we're very proud of the gold medal, but what we really want people to know is, how can the health department support me? How is the city supporting me in better health? We're not going to provide your direct health care. We're not going to fill your prescription, but here are all the other ways that we are supporting you to be healthy, and we just want you to know about them.
Anecdotally speaking, friends of mine who still live in New Orleans, they've had complaints about other agencies, mainly the Sewage and Water Board, but I've never heard them say anything bad about your office.
Okay. Good to know.
So I want to go back to the policy package that CityHealth has put together. Many cities are using that as a guide, and I know in the last 2 years, since we've expanded our footprint and made additions to the policy package, New Orleans has acted on a number of the policies in the package. Just this year, I think there was an update to the Affordable Housing Trust Fund, where they created a dedicated funding source You guys have worked on healthy rental housing, green space, legal support for renters, as the video showed, and protecting an already very strong indoor smoke-free air law. How have you garnered so much political will to take on such sweeping work?
Well, it really helps to have guideposts. Our department is very broad and it has reach in a lot of the spaces that the city health policies, reference. And it's very helpful, though, to be able to say, yes, we want a rental registry. We want healthy homes protection. And it's not just because we think it's a good idea, but look, there is a national organization who has identified this as a best practice. And that is tremendously helpful to get decision makers' attention, because they have a lot of things competing for their attention that may be worthy causes. But when we can point to something and say, look, all these other cities are doing it. Here's some examples of model legislation. Here's the research that's already been done that shows why this is important for health. Let's get New Orleans on board. It really just simplifies the work that we have to do on the front end. And, it doesn't hurt to say, look, if we did this, we could get a gold medal. And then you can go and tell all of your constituents how you work to get a gold medal. So it's the just having City Health as, a national standard in many of these has been tremendously helpful.
You guys went from silver in the first year of the 2.0 package to an overall gold this year. What was the discussion like with your team to continue the push to move from silver to gold?
Well, if you talk to any of my team, they will tell you that I and we, by extension, are very competitive. And it's not because we want to win for ourselves. It's because we truly believe that New Orleanians are deserving of the best policy and the best support that they can get. Because we are artists and entrepreneurs and cooks and professionals, and we love this city and we believe in it. And so we don't rest. We don't want to just put a policy in place that might be okay. We really want to strive for the best. We have a lot of challenges to overcome, and we always have. But we don't believe in shooting for average. So it was really an easy sell when we were having the conversations. And then our team got other agencies excited about it. So, our legal colleagues were really excited. The Healthy Homes work was multiple other departments. And once we started really saying, look, we think we can do this. This would be a great win. Let's knock it out of the park. Let's just not just settle for something that would be okay, but let's go for the gold. It was easy to get others on board.
We try to make sure that equity is at the front and center in our policies, especially in the policy package. Each policy has specific equity criteria. How do you factor in equity into your work, and how do you ensure that your work impacts those who need it?
Yeah, equity is part of our mission statement. It is imbued in our strategic plan and called out directly. We have a director level position over equity with a team that is really working to build out every one of our programs and making sure. And I think we were always committed to equity, but we really had an opportunity to operationalize it during COVID, and being very intentional about directing resources, whether it was testing, vaccines, whatever, to neighborhoods and spaces that had historically been repeatedly marginalized and repeatedly denied access. And so when we flipped that around and said, no, we're actually going to preferentially do this because we simply cannot continue to replicate the inequities of the past, and we saw the success, that made us feel really good about, okay, if we can do this in a pandemic, then we can be taking this approach in our everyday work. And it's the long game. It is really being intentional. As an example, we have a lot of interns at the health department, and we've doubled down on how do we make sure that who's getting the opportunities even to do an internship in our department are from a diverse background, are coming from a diverse set of schools and not the same old school and the same old type of person. And how do we standardize that? So everything from sort of how we do interns to how we approach big pandemic response, we really want to make sure we're doing it in a thoughtful and equitable way.
Let me ask you this. So switching gears a little, I personally am a local government nerd. I find the value in local government. I think because it is closest to the people, you can have the biggest impact. And I know that your family has a long history in New Orleans. You're a fifth generation
Ninth.
New Orleanian?
Ninth.
So I skipped a few generations. Tell me, what is it like to be your hometown public health director, and like what was the decision making like for you to decide to even go into local government and this role in particular?
It was not, it wasn't something that I had always planned on. I am an emergency physician at our flagship academic medical center, which is also our trauma center, and also, what one would consider our safety net hospital. And for me, that was the way that I initially chose to serve my community, because it is, when you're an emergency physician, you see all of the community. You don't just see certain people with certain conditions or those with insurance or those from certain neighborhoods. You see the entire community really on its worst day. And the value of that is that you are constantly being reminded of the gaps in the challenges and the real inequities in the community. And it's motivating to want to fix that. And, you can fix some things in the emergency department, but you can't really fix the underlying system. You have to go upstream. And so that's really what drew me into wanting to work at the health department, even not really understanding how that would work or how the health department did it. But the honor that, I personally have had by being able to be in a space where now I get to interface with members of my community and be in neighborhoods and churches and buildings that I never would have had access to before is such a gift. Because really the beauty of New Orleans, and I think probably of any community, is in its people and in the diversity of its people. And so it's really been, an honor. I have learned more than I have taught and gotten more than I have given, I am sure. But it's also quite gratifying to have a team around me who, whether they're New Orleans natives or not, feel the same way. It's a mission that once you buy into it, the work is incredibly fulfilling. And we've been able to make some gains. We have a long way to go, but when you can make some positive gains, whether it's some of the gold medal policies or some of our other work, then that makes you realize the potential is there and we can do it.
I see a question in the chat about preemption. I'm going to put it in, and I think one of my colleagues is going to directly answer that question, but I do want to think about it in the context of New Orleans. You guys are preempted from acting on a few of the policies in our policy package, but how are you guys thinking about, especially as we see public health become even more politicized and cities are trying to navigate that, how are you guys thinking about that issue and navigating preemption in your office?
It's a challenge for a lot of places. And things like paid family leave, we're preempted. Now, what we tend to do at the city, and this is really our city administration and decision makers, is have the city be the leading edge of the spear. We have a very robust paid family leave policy for city employees, which is several thousand employees. It is 3 months of parental leave, paid parental leave. And it's very attractive. So while we're preempted from implementing that citywide, or a minimum wage, for example, we try to set the bar really high, and hopefully be the good role model for other employers in the city. And then I'm an emergency physician, and our whole life is finding how to work around challenging systems, because that's emergency departments in America. So there are lots of ways to work on the margins of a preemption, not to, go against a preemption, but to say, okay, we're preempted from doing this particular thing, but how do we start to support policies that get at the same goal as that preempted policy? Maybe not all the way, but really just sort of to prove their efficacy and their benefits. And if you can start to chip away, I think, then you can get traction at maybe a state level that is not necessarily aligned with a lot of local levels, and make some gains, not the transformative ones, not the big leaps, but sometimes you have to have a whole lot of bunts and singles, and that wins the game just as much as a home run does.
I know that a number of cities that I've talked to are thinking about this as a major preemption, as a major issue for 2024. But for you in particular, like, what are the challenges that you see ahead of New Orleans in 2024?
Yeah, I think, one of the largest drivers of health inequities is income inequality, right? And things like paid family leave, minimum wage, particularly as your video mentioned, in a gig economy, or an economy that often relies on low wage workers, not being able to move traction. Now, as we've seen post-pandemic, that some of that, because there's pressure on wages to go up, people are now realizing, well, I actually can maybe pay my worker $15 an hour, and we're doing okay, right? So we try to highlight that, but that is a concern. Certainly a lot of prohibitions on firearm, some things we might like to do with gun safety. But again, we have pivoted to finding what's common ground, what's ways where we can reduce the burden of shootings on our public health system that does not violate preemption. How do we learn from other communities that are successfully doing it? Because there's a lot of other places, and how do we learn from sort of national best practices? And then just how do we continue to find common ground to talk about things? And I'll give you an example. Medicaid expansion is one. We were really the only state in the South to expand Medicaid almost 8 years ago now. We're having a change in government or state governor leadership that's going to be very different. We're flipping from Democratic to Republican governor, but all of the Republican candidates for governor have expressed that they're not going to undo Medicaid, because we've had time to build the case for preserving rural hospital systems and keeping jobs intact, for improving health, for reducing the financial burden of uninsured care. So it took 7 or 8 years, but working to get folks to understand the benefit of things that might have been preempted or not allowed before, they can pay off.
On the flip side of that, what are some of the things that excite you about 2024?
We locally have, we've done a lot of launches of new initiatives that are really foundational. One of them is our mobile crisis unit, which is tied into 911. And so 24/7 individuals with a behavioral health crisis who are nonviolent get an appropriate response, and not the police. And this is something that, ties to policy. I think we've seen for so long, a lot of our policies around violence and mental health have been very law enforcement heavy. By doing this and showing that it's working, we can now sort of start crafting different policies that don't involve the police. We're, looking at some maternal health initiatives that, again, we as a local, fairly progressive city are piloting, but have gotten really quickly a lot of state attention by legislators that are on the other side of the aisle, but that recognize the need to solve such a big crisis as we have in America, as a maternal health crisis, and have said, hey, let's bring this statewide. How do we get some legislation to do this statewide? So we're really excited about being being the case study. Our Healthy Homes, our rental registry, we're the first in the state to do that. And we're excited to finally be able to operationalize that, to say, hey, look, we can do it when we resource it and everybody wins, and be a model, hopefully, for the rest of the state and for other cities who might be in a similar situation, who say, oh, that could never pass. That's never going to happen in my town. Maybe it can. Maybe we can be a case study. So I'm excited to sort of get into the meat of so many of our new policies and initiatives, and prove that they're good for everyone.
Last question, and I know that New Orleans, and particularly the public health department, your office, has taken advantage of the technical assistance offered by CityHealth. I've enjoyed meeting your members of your staff through that. What has been the most beneficial part of the partnership, and why should other cities partner with CityHealth?
Yeah, I will tell you, we are really grateful for the ease with which we have a direct line, not only to experts, people at CityHealth, but also the broad swath of research and best practices and evidence. And as you know, we had a challenge. So it seemed like a small challenge, but we were really concerned it would become a big challenge to our tobacco-free law, which has been really non-controversial for the last 8 or so years. And we reached out to you all, and not only got really some sort of in-person conversations that were very, very helpful with our decision makers, but also, okay, here, look at this. Here's what other places, here's how other places have solved this. Here's what other places have done. And we were able to really rapidly take that and beat back, what could have been a really concerning challenge. So, just the responsiveness and just the depth with, of what you all do. We're really grateful.
Thank you, Dr. Avegno, for joining us today. And I look forward to testing out that gumbo next time I'm in town. With that,
I've got some in the freezer for you.
Yes. With that, I will pass it to my colleague, Catherine.
Hakeem, Dr. Avegno, thank you both so much. I just have to say, rarely have I heard in a webinar such references to sports, culture, and food, but I think that also is a testament to your love for the city of New Orleans, and we are just super grateful for you all for sharing that with us today. Thank you. For those of you who would like to learn more about our work, please visit our website, cityhealth.org. We'd also love for you to follow us on our social media channels. Check out the report. There's so much more interesting information there. We'd be happy to answer any questions that you all have. Thank you so much. We appreciate you all, and have a wonderful rest of your day.